And welcome to our live stream of spine surgery from the Deuk Spine Institute, Surgery Center of Vieira. We're going to be performing a Deuk laser disc repair. This is a unique surgery on the spine, treating painful discs that are herniated or bulging. And our patient injured his back at work. He has multiple disc herniation. As a matter of fact, 5 disc herniation. Today we'll be fixing 3 and on the left side. We're going to try to do it all with one incision, if possible, which I think we will be able to do, based on his anatomy. All right, sir, are you ready to get started? This is Dr. Deuk Majin. Are you comfortable? All right, good. So here's how it works. I'm going to put you to sleep in about 10 minutes. But I need your help in the beginning while we're getting started, okay? If you feel pain, I want you to say ouch, and that lets me know that there's a little issue, and I'll go ahead and give you more medicine, all right? All right, the first thing you're going to feel is a little stick and burn. That's your numbing medicine going in. It's very important you don't move around. I want you to lay still. We're still doing surgery here, okay? So lay still. If you feel discomfort, say ouch. Is your neck okay? Are you comfortable? All right. That's just my hand feeling things, okay? So you feel a little pinch, a little stick, and a little burn, all right? That's just normal. That's numbing medicine going in. Don't be afraid. Don't be alarmed. So we're going to start out by doing a little sub-Q injection of Marcaine, lidocaine, epinephrine. You use epinephrine?
No, I do.
No?
Yeah,
You do? A little bit?
Yeah.
All right. Sorry about that. I know it's uncomfortable. The good news is I'm almost done. Okay? Sorry, 7 cc's injected. All righty then. How's the blood pressure? Try to get it down if we can. All right, just do your best. It's important to keep blood pressure manageable at a good level. Let me know if you feel pain. Something there? All right, let me give you some medicine. All right, we're going to be doing the L34, L45, L5S1 discs. And I've given our patient some numbing medicine, just a little bit of Novocaine, some lidocaine. All right. You're doing fine. Everything's okay. But, yeah, if we can get his pressure down, it would be better. He's only in the 150s, but it's higher than I want it to be. Shot. Let's go lateral. So high blood pressure, not high as in really bad, but just anything elevated over normal, and even normal blood pressure, higher the blood pressure, the more bleeding you're going to get in surgery, period. That's a known fact. All right. So he's got a super deep spine. We may need the longer needle. Just be prepared. All right, now 5-1. I'm wondering if we could get that end plate a little better and get those pedicles lined up a little better and maybe zoom in a little bit on that level. Focus on that first. I don't know about orbiting. Maybe you need a little bit. I think you're right, but I think you need a wag just 1 degree. And maybe zoom in a little, bring my side closer. And shot. All right. I think you need to undo the orbit. Try that. See what happens. Shot. That's better. Shot. All right. Now we still have a wag issue, about maybe a half a degree. Maybe my side north. Just lay still. You're doing fantastic. And we'll need to do a little more deorbiting. You need to go south a little. You okay? All right. Shot. All right, it's getting better. I think we need to deorbit a little bit more. Shot. That may be. What do you think? That may be as good as we're going to get it right there. Let's just leave that. The only thing I don't like is we got a lot of sacrum. You can actually see a hip replacement. When did you have your hip replacement? Shot. Yeah. So that's pretty good from a WAG standpoint. We're perfect. We're looking down the disc, right through it, parallel, but I think we got an orbital issue still. So we need to play with the orbit one way or the other and just see what happened. When did you get your hip replaced? Other way. 2019? A little more.
He said 3 hip surgeries.
3. I don't like that. Go back. So you've had 3 surgeries on your hip. Wow. We're not going to do that for your back. We're going to be one and done, all right? That's our goal. Yeah, that's bad. Okay. Shot. So I put in numbing medicine. And where'd you feel that? Just relax. You're doing fine. In your back? You felt it in your back? See this? Pressure's high. All right. I'm sorry. Huh? Got to get it down. What have you given them? Just be cautious, but let's see if we can get it down a little more. Huh? You see what I'm talking about, right? Yeah. No, I know. I mean, it's just, that's on the surface. What do you think happens inside? Right? And the surface isn't. Just lay still and keep quiet for a moment, please. I've got to talk to the anesthesiologist. What you see on the surface isn't a problem. It's what happens underground that's the problem. Yeah, I know. Let's just do our best. Is that our current picture right there? Yeah. Looks pretty good. I mean, we're not far. You're doing great. Just hang in there, okay? I know. Shot. I apologize. I know. Let me see what I can do. So giving a patient some more numbing medicine is fine, as long as you're outside the foramen. So when I get to the foramen, shot, that's it. When I get to the foramen, things change. You can't be using the numbing medicine around the foramen. Now, if you do, it's not the end of the world, shot. You just risk numbing the nerve root, which I don't want to do, because numbing the nerve root means I can't assess his neurological function where I'm trying to work. Huh? Just lay still. You're doing great. That's the facet shot. Yeah, you're doing fine. I promise you. I apologize. It's a little uncomfortable, but we're making good progress. Shot. Yeah, that's perfect right there. Yeah, I know. Shot. Almost done. Shot. No, don't push. Shot. You're changing the trajectory of my needle, and I don't want you doing that. Shot. Shot. It's almost like he's moved a little bit, right? I mean, everything's moved now. It's real important you lay still, my friend. I know you're doing your best. You're doing fine. I just want you to lay still. We've got to change orbit. Up a degree, shoot it, then down a degree, shoot it. Let me see, that may be better. Shot? I can't really tell. Let's go the other way. All right, that looks okay for now. Maybe a little wag. We're kind of off. You're doing great. I'll let you know if there's any problems. Shot? So I had to start a little higher. Anything you can do to help me out here? I. Huh?
He's on big doses of vitamin and
Okay. Yeah. I know he's on huge doses of narcotics and Valium. You said?
yes,
Yeah.
10 milligrams.
Yeah. So do what you can, but shot. 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 You're doing fine. Just lay still. You're doing real good. We're almost done with this. This is the hardest part of the surgery for you. Shot. All right, release the wag. Release the orbit. Jordan, you've got to be more responsive. Shot. You've got to be taking control of the situation, you know? That's what a good tech does. Lock it. Okay? A good tech is not defined by coming to work every day. A good tech is defined by coming to work every day and doing the job properly. So you've got to, if the patient's moving, you're going to have to move with them. Shot? Is that understood? That's your job. Otherwise, I got to stop what I'm doing and tell you what to do. And I can't do that. Shot? You understand how to look at that x-ray. It looks fine right now. But you understand how to look at the pedicles, look at the end plates, look at the disc, and make an assessment about what we need to do, right? Then do it. Don't wait for me to tell you. Okay? I can't hit a target that I can't see. Shot? Okay. Yeah, so his disc is angled so far up his back. And that's what we're dealing with right now. Let's have some more numbing medicine. So I've given him plenty of numbing medicine on the skin. I'll give him a little more. And ultimately, there's only so much I can do with numbing medicine. I need my anesthesiologist to help me a little bit. With obviously with blood pressure and of course with anxiety. Huh? Shot? Shot? Oh. We're making a little bit better progress, starting a little higher. We just have to redirect. Shot? 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 That's better. Much better. Still hitting his facet joint. Shot? Just almost around it. Shot? He's got some big facets. Shot. 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 One more time. You're pulsing, right?
Yes, sir.
Shot. That's too high. Shot. Shot. Again. Shot. Shot. Where do you feel that? In your back? Shot. Yeah. That's where we are. We're so close. Just hang in there. We're almost done. I know. This is the hardest part. So there's a little window that I'm trying to work through between his iliac bone and his spine facets. Shot. I might have finally found it. I mean, it's literally a millimeter wide. Shot. It's the hardest to get to. Are you okay? You're doing great. This is the hardest disc to get to, so that's why I start with it. I apologize. I wish it was more comfortable for you. Just lay still. I need him. Huh? I couldn't hear him. Try to get him comfortable. Long story short, a lot of endoscopic surgeons won't even do L5S1 at all. Are you okay? So I'm trying to change the trajectory here so that I can hit the disc. Shot. Where do you feel that? What do you say? In your back. Not down your leg. AP. I couldn't hear what he said.
Is that the shooting down the line? Okay, we're good.
We're good. Yeah, blood pressure is better, which is good. You can do even better than that, I'd be happy. No, I know you are. Look, I'm not asking you to work a miracle, but... And where's the lateral view? The AP is off. We need to get those spinous processes lined up. I don't know, maybe the other way. Yeah, a little further. Keep going. Shot. That's better. Yeah, that's better. All right, let's go with a lateral view. Now we're being forced lateral at 5-1, which is a problem. I have to see if we're gonna make it. It's awfully close. Can't see. Where do you feel that? In your back? How far down?
How far down your leg? To the calf?
All right. Is that better? All right, let's rotate a little bit. Is it better now?
Is it soft?
Shot. Uh-huh. Rotate more. Shot. That's too far. Keep going. More and more. You know you have to go past that point. That's probably better. Let's see what that is. Shot. That's probably the closest we've gotten it. And yeah, we're just a little too high. Let's try for 4-5 right now. We'll try 5-1 when we open up a little bit. Some more numbing medicine? Give me a lateral. Now you rotated. Blood pressure is pretty good. Could live with it, but if we can get it down a little, I'll be happier. Shot. Give me some numbing medicine, Shot. Can we do better at 4-5? Shot. I think you're rotated at 4-5. I don't know if we went the wrong way. Shot. That's just off. You can't see the pedicles at 4 are off aligned. What are you waiting for, Jordan? Give me some orbit. Release it. Shot. 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 Is it moving after I move it? Shot. You gotta watch your hand. I think you're holding the fluoro button a little too long. Shot. 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 All right, let's wag it. Lock the rotation and wag it. Shot. 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 Release the orbit. Shot. Shot. Try not to move. All right, lock it there. 5-1 looks better too right now.
Yeah.
All right. Shot. 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 So right on the facade. Shot. 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 You doing okay? I'm gonna have to start a little more lateral. Just the slightest bit. Shot. 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 You all right? Shot. You've got a lot of arthritis back here. In your, when was your injury anyway? Shot. Do you remember? Shot. It's okay if you don't. A long time ago. Shot. All right. You comfortable? All right, we're awfully close to where we need to be. AP. So there are several factors that are affecting my ability to get in. Number one, he has an extremely small foraminal opening because of the short pedicles he has. He was born with short pedicles, nothing to do with the injury to his spine. Number two, he's extremely big guy from a standpoint of just being thick, and that makes it a lot harder to get to where we need to go. And then yeah, the arthritis of the facet joints makes it challenging. Shot. Let's go lateral. So I'm feeling bone spurs there. You can actually see them on the x-ray. So I've got to get, when you injure your discs in an injury, how long ago did we say it was? 20 years. Okay, 20 years ago. Injure your disc. Now your spine starts to move around. It's a bit unstable. And that causes the facet joints to respond. And they get bigger as they try to stop the spine from moving abnormally. Shot. Are you awake? Yeah. As the facet, where do you feel it? In the back. In your back. Shot. Shot. Yeah. That's good. Where? In your back? Huh?
Same place? Okay, hold still.
Shot, no. It's, I think I'm a little bit lower than I need to be. Shot? Is there anything you can do, Jordan, to help me see that better? Shot? Shot. Why don't you rotate this side up a little bit? Shot. Again, more. I just cannot tell if that's improving it. It looks worse. Huh?
It does to me as well.
You must have a lot of rotation there. Go back. That's maybe the very best we can do right there. Shot. 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 Where do you feel that? Where do you feel that? Back or down your leg? Huh?
It's not going down the leg.
All right. What do you say?
The one time you got to go down the leg.
Yeah, but not this time. That's all in your back? Where do you feel that? Give me an AP. Okay. The pain medication you take, is it for your back?
Take the pain medication for your back pain? Yes.
Let's have the longer needle. Is that better? All right, I apologize. I wish this would be easier. You're a big guy and you got a lot of arthritis, and unfortunately you're just responding to pain more than I want you to. And our anesthesiologist, I think, is doing the most he can. So it's going to get a little uncomfortable, but I'm not giving up on getting it. I just want you to know we're doing our very best, okay? So hang in there. Shot. Let's go lateral.
Yeah. Sure.
I didn't understand what he said.
He said pain gets worse. I'm gonna give him a little fentanyl. He's got sleep apnea, and I'm cautious about that.
Yeah, normally we'd be in and done by now, but for some reason that's not happening. Huh?
This calculated thing given for fentanyl on top of all the other drugs is activated.
Yeah, no, I'm just telling you, Santiago does these and the patients don't move, they don't say anything, they just lay still and they're comfortable. I'm telling you, you got to look at what he does. And it's just like neurosurgeons. Nobody else does this that I do. It's special and unique. And I have access to the same tools and equipment and medications they do. They just don't do it. They can't do it. There's something Santiago does with his patients that they don't move around, they don't feel it. They're very comfortable. And huh? I can't understand anything he's saying. Shot. But when they start tightening up and moving, it makes it almost, along with the other anatomical features I'm dealing with, it makes it really hard for me to access what I need to access. I'm already dealing with severe limitations. Shot. 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 Who gave you all those pain medications? Who? Yeah. Okay. Got it. Let's go ahead and wag it. Shot. 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 Yeah, you're doing great. Just hang in there. Shot. Shot. Let's lock that in. Shot. 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 I cannot see. It keeps moving. Shot. 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 Can you zoom in a little more, please? That's good. See what that does. Shot. 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 Is he awake?
Wait,
Yeah. Shot. All right, let's go AP. You're fine. Just want to make sure you're still awake. All right, let's go back to a lateral. How did that move? Right? It moved out. Shot. Interesting.
Keep your hand down.
Yeah, you're fine. Just lay still. Shot.
Don't move. Stay where we are.
We're very close to where we need to be. Shot. It's just not able to get past the arthritis of the facets. Huh?
Start a little lower. Because you were up. You made it
Shot.
once. Which angle is?
Shot.
Stay a little lower.
Shot. How is he doing? Shot. He's doing good. Shot. The trajectory is good. It's just his facet is too big. Shot. Shot. Finally. Shot. Where do you feel that? In the back? Shot. Where do you feel that? Shot. It's just too low. Yep. The bone is just redirecting me, Shot. I'm unable to go where I want to go because of arthritis. The big facet joints, basically. Shot. Just getting deflected. Where do you feel it? AP? In your back?
Shot to your butt.
Just the butt? We could live with a butt shot.
It's stopped now.
Uh,
Not feel pain now.
yeah, it's no good. No good. I'm not happy with that. I've gone as lateral as I can go. All right, let's try one more trajectory. No, we're numbed up good. this is a patient with probably facet joints that are 3 times larger than normal. You okay? What's he saying?
He's talking about it hurts when he leans over the table. Do another exercise.
Yeah, we're going to get your back fixed. I'm trying to do this with the laser here. I'm not having much luck, lateral. We may have to do it open.
A lot of bony arthritis in the way.
Huh? What do you say?
He's asking how much luck there's a lot of bony arthritis in the way.
There's too much arthritis. Your injury was so long ago that your body has created bone spurs that your joints have gotten bigger than they're supposed to be. And those are the facet joints, and they're not letting me get into your disc to fix your disc. So we may have to abort and do this the old-fashioned way, open surgery, which we'll talk about in clinic. Because if I can't get it, if I can't get access to the disc, AP. What's he saying?
You are talking about at different times, or you talking about right now?
Lateral.
Okay, well, right now we just went over this needle's aggravating your.
Yeah, just let us know if you're having any pain. Shot. Shot. It's all that arthritis there. Yeah, no, I know. We were very close, but it wasn't close enough. Shot. It has to be perfect for me to be able to do it. And I just can't get around your arthritis. That's the problem. Shot. And when I get around it, it pushes the needle out of position where I don't want it. Shot. That's the problem I'm coming into is the bone spurs you have in your back are pushing my needle. I'm trying to use a needle to get into your disc, and it's pushing it to the top or bottom of where I need to go. I mean, there's so much arthritis here. It's incredible. Yeah, this sucks. I just can't get in. Shot. There's not much I can do about it. We can fix it another way, but not this way on this side. We're gonna have to do something different. Shot. I can't do that today though. We need to sit down and talk about your options. There's just no way around this massive bone right here. It's just impossible. So for those of you watching, look at the tip of the needle, and there's this grayish stuff, and that's all hypertrophied sclerotic bone. The normal facet joints, if you look further up the spine, that's what you should see. So the darkening of the facets tells you this bone is reactive bone. It's just massively enlarged, Sean. And it's literally pushing the needle. I could feel it pushing the needle, Sean. It's hard, and it's pushing my needle. All right, maybe there, we'll see. Sean. Let's see, this will be our last effort. I just can't do anything more safely here. Where do you feel that? Where do you feel that? AP. In your back? Where? What's he saying?
He says legs get sciatic.
You're getting leg pain?
Or back pain?
Yeah, shot. Yeah, he's having both. Yeah, it's too lateral. All right, well, we're not going to be able to do this. unfortunately, too much. His injury was 18 years ago. As a result, he's developed enlargement of the bones in the back of the spine, which have grown to the side, and it's pushing the needle to the side. Well, today was the left side. Yeah, we were trying for the left side, but we couldn't get it. I just couldn't get it. So we'll talk out in the recovery, okay? We're going to fix your back if you want us to, but I can't do it with the laser on the left side. And on the right side looks just as bad. I just don't think we're going to be able to get the right side either. So we'll talk about what your options are, okay? But we can fix it, but it's going to probably have to be with the open surgery. All right, folks. This is an example of someone I couldn't do with a laser. Unfortunately, we gave it our best effort. I tried multiple different entry points, trajectories, and no matter where I went in and where I aimed, to get to the disc that I need to fix, the facet joint behind the disc kept pushing my needle either above where I was supposed to go, below where I was supposed to go, or laterally to the side. So we have to abort. Unfortunately, one of the realities of surgery is sometimes you set out to do a surgery and the patient's anatomy just doesn't allow it to happen. It's not often, but it does happen. And today is one of those days. So we're going to have to regroup and come back with a different plan. But all right, Sean, I'll head over shortly.